The World Health Organization has declared a global public health emergency following an outbreak of a new strain of the MPOX virus in Africa.
It's also more transmissible. It spreads more easily from person to person.
This is the second time in 2 years that the WHO has declared MPOX a global health emergency.
Hey everyone, today we are diving into a topic that's been making headlines lately. That's MPOX. You might have heard about it, but there's a lot of confusion out there. So let's break it down together, shall we? First things first, did you know there are actually two families of MPOX? Scientists call them clades. Fancy word, right? We've got Clade 1 and Clade 2. Think of them like cousins in the MPOX family. Clade 1 is the troublemaker of the family. It's mainly found in Africa, especially in the Congo. This one's more infectious, more likely to make you sick, and sadly, more deadly. It's been known to have a fertility rate of up to 10%. Pretty scary stuff. On the other hand, Clade 2 is like the chill cousin. It's mostly hung out in West Africa. It's less infectious, doesn't cause as much disease, and thankfully isn't as deadly. Remember the MPOX outbreak we had in the US and other countries back in 2022? That was Clade 2. Now let's talk about that 2022 outbreak for a second. Despite all the panic, it turned out to be not as bad as we initially feared of. The survival rate was super high, like 99.9%. While Clade 2 isn't easily spreading, it needed a lot of close contact to transmit, which is why we saw it mostly in men having sex with other men or in other situations with really close contact. But here's where things gets interesting. There's a new player in town, Clade 1b. This one's causing a stir, especially in the Democratic Republic of Congo and neighboring countries like Burundi, Kenya, Rwanda, and Uganda. Clade 1b is a bit of a wild card. It's more infectious than Clade 2, which means we are starting to see some more changes in how it spreads. Now get this, people are catching it just from contact with infected people's clothes or beating. You don't even need to have sexual contact with someone to get it. Pretty wild, right? Now here's where things get a bit more serious. It's not as deadly as the original Clade 1. Instead of that terrifying 10% fertility rate, we're looking at something closer to 3.5%. Still terrifying though. And here's something really concerning. It looks like children are more at risk than adults with this strain. It's definitely not what we are hoping for. Let's zoom in on the Democratic Republic of Congo for a moment, because that's where Clade 1b is hitting hardest. The numbers coming out of there are pretty shocking. They've seen about 27,000 MPOX cases. Yes, you heard that right. 27,000. And sadly, over 1,100 people have lost their lives to this outbreak. It's a stark reminder of just how serious the situation is. The scale of this outbreak is so severe that the United Nations has stepped in. They've put out an appeal for $18.9 million in assistance to help tackle the MPOX outbreak in DR Congo. That's a lot of zeros. So folks, it shows just how much support is needed to get this under control. Now here's the kicker.
Sweden's public health agency says it has recorded the first case of a contagious new variant of MPOX outside the African continent.
More cases of the dangerous variant are likely to be found in Europe in the coming days.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
So folks, there you have it all. That's the lowdown on MPOX, where it came from, how it's changing, and why it's making headlines again. So stay tuned, stay informed, and most importantly, stay safe out there.